It is the Martha Zoller Show, and I am here with Greg Bluestein. We are live at the Capitol in John Kennedy's office. Thank you, Senator Kennedy.
Senator.
Thank you. Greg Bluestein is here with me right now. How are you?
I'm doing great, ready for another very long crossover day that will stretch into the night.
Very long crossover day that I want to talk to you about, because there's a lot of things I thought we're going to get here that I still don't know, and we'll get to that in a minute. But we're now a week down the road from the death of Laken Riley, and this story has not gone away at all. It is a national and international story. I read international news almost every day. There's something about it. There was more about it. The mayor of Athens is going to be on with one of my old friends, Tim Bryant, this morning. There's a lot going on. This story is a game changer.
Yeah, it's so important. And every year we have a surprise issue at the Georgia Legislature. Unfortunately, this surprise issue is also such a tragedy.
Issue.
It's such a tragedy. And you're right, it's hard to think about it. It's just a week ago when University of Georgia and all of the entire community had changed irrevocably with the death of the suspected murder, we can say, the slaying of Laken Riley, and how it's jolted not just Georgia politics, but national politics. There's a reason why both Donald Trump and Joe Biden are in Texas right now visiting the U.S. border with Mexico. And at least one of the reasons is because of Laken Riley.
And you know how stories go, that you might not report about something very often, and then a lightning rod story like this comes up, and then you start hearing about all kinds of other ones. So we hadn't heard much. We'd sort of heard about the illegal immigrants that attacked the police officers in Times Square, and that story had sort of, but didn't have the kind of legs this one did. And please, to all those that are still mourning Laken Riley, I'm not trying to talk about her as if she is an issue. She's not. She was a real person that just went out for a walk, a run in broad daylight. Okay, she should not have been killed. But there's stories that have popped up in Washington, D.C. of a 2-year-old child getting caught in the crossfire. There are now these stories that people are telling. So we're seeing it not just here, not just Texas, but all over the country.
Yeah, and this is a perfect example, because just a few weeks ago in an interview with me with Governor Kemp, I asked him, hey, what do you think about state-level immigration issues? Because he had just traveled to the border in Texas to go to Eagle Pass to put more pressure on the Biden administration to take more urgent action to control the border. And he said, no, I don't really see anything on the state level we can do right now. Well, that has changed dramatically, and now there's several proposals moving very quickly through the Georgia Legislature that could reach some key votes today.
Well, and you really need to see nothing but what's happened in Texas. I think it's funny that they're going to Texas, both of them, because there's nobody crossing at Texas anymore. Because if you want to see an example of that you can reduce illegal immigration by putting a wall up, that's what Governor Abbott did, and Texas is almost down to nothing, and they're all moving to Arizona, New Mexico, and the sanctuary state of California.
And that's part of Governor Kemp's argument, is that, hey, when in Texas, where they're asking for more resources, where Georgia is among the states sending National Guard troops, there's about 29 or so already there, and there's about at least a dozen more that are headed that way. You can more effectively try to patrol the border if you're not getting federal help. But it's a different story, in his view, for the other border states that aren't asking for those other state and federal resources.
Absolutely. So we're going to keep watching this very closely and how this plays out. I think at the beginning of this session, I remember saying, man, there's a lot of really big issues that might come up. Medicaid expansion, CON changes, gambling, you've got school choice, all of that. Now, school choice has passed one chamber already, so it only has to get through the other one, right? So it has the best chance, I think, of all these big issues. Medicaid expansion looks like maybe no.
No.
I mean, it looks like no. I talked to Carol Burrell, the head of Northeast Georgia Health System, and she says there'll be some tweaking around the edges of CON, but that CON is intact. And in fact, that's what she and other people from the Hospital Association and big hospitals, that's what they want. And then, I don't know about the gambling thing, how far that'll go.
Yeah. Well, let's start with Medicaid expansion. It is a no for now. And the biggest signal of that was the House put in its latest CON bill, its latest hospital bill, a study commission, basically kicking the can down the road for another year. Doesn't mean it won't happen next year. It probably has a decent chance of at least being a revived debate next year. But it was always facing long odds to pass this legislative session, and now it would be a tremendous surprise. I would not bet on it at all. In terms of CON, there's some big divides over it. The Senate and Lieutenant Governor Burt Jones want to do away with CON regulations entirely, or at least completely overhaul them, if not eradicate them. The House, has more of a nuanced approach to it, and both sides are going to have to hash that out. And we only have a couple more weeks left, so it's hard to see anything substantive passing with CON. School vouchers, school choice is what conservatives call it. That has been a surprisingly quiet issue. Remember, it died last year in the House. It failed with a revolt of about 16.
Governor came out for it early in the session.
Governor came out for it. The lieutenant governor came out for it. Other key leaders came out for it. 16 House Republicans helped doom it, most of them from rural areas where their local school chiefs were against it, worried that it would sap funding from local school districts. So there's a good reason that hasn't come out yet, because it's already passed the Senate. So the House can focus on getting those votes. People are still very confident it will pass, but they don't have to pass it before crossover day because it's already passed one side of the it's already passed the Senate.
And we're in that second year of that cycle.
We're in that second year.
And getting back to the healthcare issue for a minute, the Medicaid issue, we did expand Medicaid last year for women. But I think that we in the media have a responsibility too, because, and I'm not saying you, but a lot of people that write about healthcare, they will say things, they will lead you to believe that you can't go to the doctor if you don't have insurance. And I know at Northeast Georgia Health System, they have a whole clinic in place that's just for folks that don't have insurance, that's got good doctors staffing it. We have Good News at Noon. We have other things. I know in my husband's own practice, if you told us you didn't have insurance, we just said, okay, let's come up with a payment plan. We never turned anybody away. And the average person, though, when you talk to them, they think if they don't have insurance, they can't go to the doctor.
Yeah, you're right. And look, that uncompensated care is a huge cost center for hospitals like Grady and Atlanta and others that spend a tremendous
Northeast
amount
Georgia
of
Health
Northeast
System.
Georgia. The hope, though, for people who support Medicaid expansion is it will lead more of preventive care rather than going into the emergency room every time something bad happens. And look, I've done ride-arounds, I'm sure you have, with ambulances, and it's shocking sometimes to see how many people call 911 over a fever, a sprained ankle, reasons that most people would never call 911. Some people do, and it ends up bogging down the medical system. So the hope is for the supporters of Medicaid expansion, it will encourage more preventive care, which will, in the end run, drive down long-term health costs.
So my cousin retired from doing a lot of healthcare policy, and he said to me a long time ago, Martha, you need to look at France. France has a healthcare plan. Basic healthcare is covered by the government. If you want more than that, you have to buy a policy on top. He says it works the best. Everybody looks to the UK, but really France has got the best one. And the problem I have, though, is on the federal level, I don't know so much on the state level, but what is basic health care? I think that, to me, basic health care is your regular checkups, the follow-through from those, whatever, you need a colonoscopy at 40, you need this at that, whatever it is, those kinds of things. It's not cosmetic surgery. It's not, elective surgery. It's not those kinds of things. And that's where the hitch is, because a lot of times, and I remember when we were trying to when Obama was passing ACA, the discussion about what was mandated care was the sticking point, because everything's not mandated or shouldn't be, because then it doesn't mean anything. No,
and you're right. And it's going to be I think it's going to continue to be a huge debate in Georgia. I think if you give a lot of Republican lawmakers a truth serum, because they've told me this privately, they want to get it off the table. They want to pass Medicaid expansion. Georgia's only one of 10 states that haven't. Mississippi's now debating it. North Carolina's passed it. Florida, Indiana, and the list goes on and on of red states that have, or purplish states in some cases, that have passed Medicaid expansions. They also know that poll after poll after poll shows a broad majority of voters, including conservatives, support some form of boosting the Medicaid rolls. So if you're running for governor in 2026, if you're looking at higher office, you want to take that off the table for Democrats to keep pummeling you over. At the same time, you kind of need to do it in a conservative way. And that's why most Republicans who are talking about it, either publicly or privately under this gold dome, are saying the Arkansas-style option.
One final question, and you may not know the answer, and that's okay. The governor did try to roll out a plan that people could apply for, and I was looking forward to it. And it's finally starting to get people to apply, but it did not get off the ground the way it should. Because I'm a self-employed person. I pay top dollar. You know what I mean? And thank God I don't have a mortgage, because I basically pay a mortgage for my health care because I'm 64. Okay? So I was looking for it, but it didn't seem to get the traction. Why do you think that is?
Yeah, and you're talking about the Pathways program, which is there's academic and work requirements in order to be eligible for Medicaid expansion. And part of it, look, is how many of your listeners have heard of Pathways? It's hard to market this, right?
Yeah.
It costs money to let people know that there's a program like that. You have to educate the doctors, the healthcare officials, but you also have to educate the actual Georgians to know about this. And so the concern for a lot of the critics, who even some people who like the idea, is that it costs so much money to market it that you might as well just expand Medicaid.
Absolutely. Greg Bluestein, what are you running around looking at today?
Everything, but really immigration-related measures. That's what I'm really focusing on today.
Yeah, absolutely. And I'll be here all day. We're going to be talking to some folks. I'll be here all day. And then I'm going to be on Lawmakers tonight. So I've got a long, full day. I'm gonna spend the night in a hotel. I'm not going back to Gainesville, and then I'm gonna do Georgia Gang in the morning. So
nice.
I'm gonna be everywhere. It's gonna be
all
fun.
over Atlanta,
all over. Greg Bluestein, thanks for being with me today.
Thanks for having me.